tooth is anything from a really, really small hairline mark in the enamel of the tooth, right the way through to a tooth literally cracking in half. Teeth don't ever break the same way. You probably won't see the same even in the same person. So you can get like the crazed lines that often don't cause a problem because they're just, as I say, just in the enamel, to a crack in the cusp of the tooth, which is one of the four corners of a molar tooth, that you might get a crack there. You can also get the whole tooth just cracking in half. So there are lots of different ways that they can break, due to, depending on what kind of trauma has caused the injury to the tooth in the first place. A crack in a tooth is really difficult to diagnose unless you've got a great big lump missing from the tooth or you can visibly see the crack. They often don't show up on x-ray, so we have to kind of go with the symptoms that the patient is describing. So it can kind of be pain on biting, sensitivity, that kind of thing. So that would kind of lead the dentist to be thinking that there might be a crack somewhere in that tooth. Now, if you're going to the dentist because you've got pain on biting and sensitivity, often what the dentist will do, if there's a filling in the tooth, they will take the filling out. Now, then they can normally see the crack, or the little piece of cracked tooth will actually come away and they can fill it and problem over, all the symptoms go away. Now, what they might do if they can't see a crack or nothing shows up when they take it out is maybe put a sedative dressing in there just to see if there's a really small crack, if they can just sedate the area and put filling in again, if it works. For some vertical cracks that go down past the gum line into the root of the tooth, unfortunately, it's the end of the life for the tooth. The tooth can't be saved. We don't have a way of sticking roots back together. So unfortunately, it will either be full or partial extraction of the tooth. In some cases, you can just sort of take away half of the tooth if that bit's wobbly and the other bit isn't, and then you can sort of restore what's left of the tooth, so the tooth will be half a tooth, if you like. But for the majority of people, if it's gone that far, it will mean extraction. For cracks that need a bigger restoration, that it might lead to being the tooth is more filling than tooth, often a dentist will suggest putting a crown over the top because that will protect it, protect the filling because it will cover the whole thing over.